Good morning. Thanks for hanging in there. This is the hardcore group. This is the last session on the home stretch. My name is John Moon. I'm with the Federal Reserve Bank of San Francisco, and you are at the Building Community Capacity from the Inside Out session. And as the session describes, what we like to cover is in revitalizing cities, one of the challenges is capacity issues and resource issues. And as we know, we've been operating in an environment where there's been a level of diminishing resources, both public and private sector resources. And so our session here in our panel will be talking about an innovative approaches to their work in their cities that not only deal with the capacity issue, but actually fundamentally rethinks about how we approach the very difficult challenges facing our cities. So before I begin, I'd like to just get a quick sense of who's in the room. So I'll call out different categories, and if you could just raise your hand to say, and you may belong to one or more than one category. So let's see. What about government people? Okay. What about financial intermediaries, banks and CDFIs? Okay. How about community-based organizations? Nonprofits. Okay, so a lot of practitioners here. What other groups? Fed staff, a separate category into itself. All right, I think that gives us a good sense. So what we like to do is I want to keep this as dynamic as possible. We're going to engage in a conversation with the moderators. With the panelists. For the next 35-40 minutes, and then we'll be sure to leave some time for Q&A at the end. So we have a fantastic panel, and I'll ask you to refer to your panel bios on the conference materials. But just really quickly, so on my right is Monique Baptiste-Good, who is the project director for Newark Strong Healthy Communities Initiative. To her right is Robin Hacke, who is the advisor to the CEO and former director of the Integration Initiative, and Tamar, who is the director of the Working Cities Initiative from the Federal Reserve Bank of Boston. It is a fabulous panel, and they've got a great deal of terrific things to say. So one of the recurring themes of this conference I've heard is we need to have a more comprehensive approach. Our sector-specific approach to affordable housing or to education or to health is not sufficient relative to the complexity of the challenges that we face. And within the social sector, over the last several years, this notion of a more comprehensive approach, or the way one group has termed it, collective impact, has gained a lot of interest and traction. And so collective impact is something that a group, FSG, had termed through an article from the Stanford Social Innovation Review. And what I'd like to do is just spend just a little bit of time on that framework because it will help to explain the approach that each of the panelists are taking in their different cities. And just so that we're starting on the same page, because actually I've heard collective impact used in so many different settings, it's in some ways almost lost its meaning. So there is actually a definition, there is a framing of this, and I just wanted to make sure that we're all sort of operating off of the same basis. So what I'd like to do is just give you a quick snapshot of what we mean by collective impact using FSG as a guide. And we recognize that there are a lot of other models, whether it's a community quarterback or collective action. The whole notion is the same. It's all actually derived from network theory, from complexity theory, that networks need to work together. So collective impact. FSG has done actually a really good job of describing it, that our complex social problems are intertwined, are dynamic, are variable, and change constantly. And our single sector approach, whether it's reduction of carbon emissions, or improving education, or improving recidivism, all require a very complex approach to complex problems. And so the way they describe it is we have to move away from the mindset of a silver bullet and move into the mindset of a silver buckshot. So that's one idea. Now, within their model, they have 5 guiding principles, and I'll just cover them super quick. So the first one is establishing a common agenda. So you have to define the problem. You have to have a shared vision, and you have to have a joint approach to tackling the problem. So, for example, one example might be we will reduce obesity by 20%, a defined goal. Number 2 is collecting data and measuring results. So how do we break down the problem? How do we clarify our roles? For example, for the obesity question, where are the pockets of obesity? Who's the target? What are our defined specific outcomes? How do we measure the effectiveness of the intervention? It really is data-driven. The third one is mutually reinforcing activities. And basically, participant activities will be differentiated, but it will be coordinated. So if you target obesity at the level of schools, it would involve, measuring physical activity, availability of sugary drinks, access to fresh foods, all of which involve different partners and require a different action of those partners. The fourth one is consistent and open communication. So because this is orchestrated coordination, there needs to be communication of metrics, assessing data. And another aspect of this work that's really important is that it's emergent work, meaning that we have a notion of what the problem is and what the solution is, but we're operating in a very complex environment, and so we have to maintain a level of adaptability and fluidity so that as we get information back from the data and the measurements, we can actually assess whether or not our ideas are working. And even as they work, things are constantly changing. So there's this important idea that it's an iterative process. We're not trying to figure out technical solutions because these problems are not technical in nature necessarily, but we have to have an adaptive approach to understanding and really making a difference. And then finally, there's the role of the backbone organization. So collective action doesn't happen naturally. In fact, in many ways, it's an unnatural act, and it requires a lot of coordination. And so the backbone plays a wide array of roles, from convening, from defining the problem, from even simple things as administration, communication. It's the operational and strategic arm of these initiatives. So common agenda, collecting data and measuring results, mutually reinforcing activities, consistent and open communication, and the role of the backbone. So why do this? Why take on this? I think when you hear about collective impact, you just intuitively think, this is great. I mean, we should have a comprehensive approach to these complex social problems. And so everybody jumps on board. And I think in some ways we have seen this. But there is a real challenge in this work. And so our panel here today will talk about the nuts and bolts and the nitty-gritty of their initiatives and the lessons that they're learning. And what we'd really like to do here is to make sure that you walk away with an understanding of how this might apply in your own context. So as you think about that for the Q&A session, we really want to make this as application-oriented as possible. So we want to try to clarify any issues. But really, how does this in the end translate to work on the ground? So with that, I'm going to ask each of our panelists to briefly describe their initiative, just give us a sense of the scope of their work and the objectives and the geography and the challenges within their initiatives. And so I'll actually ask Robin Hacke to start it off. The integration initiative has taken and was a pioneer in this, and so they've taken on this approach. And so we'll start from the very top, kind of a principles approach, and then talk about the specific examples. So, Robin?
Good morning. Thank you for being here. We're looking forward to hearing your questions. The Integration Initiative was an effort at Living Cities that started about 5 years ago. Living Cities itself is a collaboration of 15 foundations and 7 financial institutions. It's been around for more than 20 years, which, if you know philanthropy and its limited attention span, is kind of an achievement in and of itself. And the Integration Initiative really predated the definitions that John just shared with you about collective impact. But it was a kind of inchoate sense 5 years ago that, the problems that we're facing are too big and too complex, what they called wickedly complex problems, to be addressed by a single organization with the traditional funding model that philanthropy has used. And so what we set out to do 5 years ago was to challenge communities across the country, working primarily at a city level, not at a specific neighborhood level, although we can talk more about that in a minute. And we invited people to say, what are you doing that's really moving the needle for low-income populations in your place? So it was an open challenge in terms of the content. It could be about workforce, it could be about health, it could be about any kind of anchor-oriented economic development. We were agnostic about the issue. But what we were not agnostic about was several principles of how the work would get done. And what's interesting about the rest of the panel is you'll hear kind of where this has rolled over the 5 years, which for us from where we started was very exciting. So what were the principles? We would have used the 5 that John just mentioned if they had been written in an article at the time, but they weren't, and so we kind of, oh, okay, sorry.
You want to sit up here?
Whatever. Is that better? Okay. So we had some general principles that all of the sites that applied, and certainly the ones that were chosen, which were Baltimore, Cleveland, Detroit, Newark, you'll hear from Monique, and the Twin Cities, they all applied these principles. So what were the principles? The first was that we were looking for cross-sector efforts, and we called it at the time one table. It turns out in a big city you don't have one table, you have many tables, but we were naive. So cross-sector, the idea that you were going to bring together nonprofits, the private sector, and government to solve a particular problem was in fact at the root of what we were trying to do. The second thing, which turns out to be very tricky, was we were saying that we were not about doing a project, we were about changing a system. And it turns out that while that seems like a simple idea, in practice, when you go implement something, a lot of times systems change starts with a demonstration or a pilot, and then people fall in love with their project and they forget that they were supposed to be doing something else. So the whole tension between project and system was something that we struggled with over the life of the initiative, but the very clear intent was to say, you know, what we're really about is system change. And the example that I can give you, which for me at least made a difference, is there was a program that we learned about in Boston that was very successful in helping students get through community college. They created a system of college navigators, and no matter what obstacle the students ran into, you know, there would be a navigator who was sort of at their elbow helping them figure it out. And they had great results. And so they looked at what it would take to scale up such a program, and they found out that it was so expensive that there was no way that this navigator program, effective as it was ever going to get scaled. Then they realized, you know what? It's not our goal to have navigators. It's our goal to get kids through the system. And so what they did, which is exactly what we mean by system change, is they took a step back and they said, what did the navigators teach us about the barriers to completion? And let's address those barriers, right? So all the people who do the integration initiative or all these initiatives are people who are really concerned about low-income communities and the people who suffer from the systemic challenges that are put in front of people's progress. So this is not about working around those as though there's some inevitable force of nature. It's about figuring out what those barriers are and then busting through. And that's what we meant as the difference between a project or a program and system change. It's sometimes hard to keep that in mind as you go along. The final principle for us was scale. And we were really looking to create change at a level that grants or subsidies alone was not going to be able to do. And so there was an imperative, which was quite uncomfortable for a lot of people, and it was imperfect at best, to use private sector capital as part of the solution and to try to figure out what do we do so that the subsidies and the grants that we have available become the basis for using private capital to solve some of these social problems. If anything, that was the hardest aspect, and we can talk more about that in the Q&A. But it turns out that if you look at who naturally ends up around the table when you try to address some of these systems challenges, People forget about the CDFIs, about the bankers, about the financial people from their anchor institutions. And so if we had assumed, which we did, that these people with a market perspective were naturally going to be at the table, what we learned is they're not. So I look forward to sharing some more of the lessons from the integration initiative as we go through, but why don't you get introduced to the products of what came out, and then we'll go back.
So Tamar, you want to come up?
Good morning.
Good morning.
I am Tamar Kotelchuck. I am the director of the Working Cities Challenge for the Boston Fed. So, what is the Working Cities Challenge? The Boston Fed did research on smaller industrial communities in our district. Many of the poor people and immigrants living in New England live in smaller cities, not in the big metropolises that are often associated with poverty. And as we think about those people, we initiated a national research project on smaller industrial communities, which ones do better for their residents and which ones don't, and why. And what we found was not what the economists expected to find. So anchor institutions matter, educational levels of residents matter, but there are cities that do fine with less than perfect indicators on those fronts. The key element in which smaller industrial cities do well and which ones don't, our economists found, was collaborative leadership. People working together across sectors on a shared vision of how their city is going to be revitalized. I've been a practitioner in community development for over 15 years before I came to the Fed, and I want to say that that really resounds with my experience in these cities, which is that facing economic distress, a lot of these smaller places are fighting, spending all of their time and energy fighting over a shrinking pie and trying to figure out who owns what piece of that pie. We know that with the size and gravity of the obstacles facing these cities, you really have to be able to step back and take a more creative approach that capitalizes on the assets of all of the talented leaders and institutions and residents in these communities. So we set about trying to think how we would support the development of collaborative leadership in these places. And we began by inviting smaller Massachusetts cities to think about what projects they would want to do that would both grow their collaborative leadership and have a positive impact on their low-income residents. So Massachusetts has a class of smaller cities outside of Boston that are home to almost half of the poverty in the state. These are places that have a lot of immigrants. They struggle with employment. They have struggling school systems. For these cities, the entrenched leadership in both the public and the nonprofit sectors is really a big issue. Interestingly, in Massachusetts, a lot of these cities have recently elected younger, dynamic mayors, and our work to support collaborative leadership in the cities is melding in a really interesting way with a new style of governing that these mayors are attempting to implement. So we wanted to find a way to incentivize, or more than incentivize, maybe to support the collaborative leadership work where there were leaders that wanted to implement it on the ground. And we know that that takes resources. It takes community organizing. It takes a backbone organization to make it happen. And we were trying to think about how we could do that when we met living cities who had had a similar experience in bigger cities across the nation about where they found that the success of their investments was much stronger in communities that had this collaborative leadership as opposed to the ones that didn't. We created a challenge that distributed $1.8 million in grant funds to communities that competed on projects that would develop collaborative leadership and support low-income people. I'll tell you more about the process. 6 cities received awards this January. And we have begun with them to implement a number of projects to develop that collaborative leadership. I will say more about that with the next slides. Before I talk about our application process and our winners, I just want to note that we ourselves are a collaborative leadership effort. So the Fed is staffing the Working Cities Challenge, but the prize funds are provided by Living Cities. They're provided by a large association of private industry called the Mass Competitive Council, and by the public sector. And that's pretty exciting for us because that is a group of folks with a lot of power over policy and private investment in the smaller cities in Massachusetts. And just to say again, we provide leadership and staffing. Objectivity is important to the Fed, so we did not sit on the jury, we did not pick winners, and we did not use our own money to support the prize funds for these communities. What we did do was help to design the process with our partners. And we designed a process that was that through its implementation would build the capacity of cities as they designed their projects. So, first of all, we let cities decide what they were going to apply to us for. As long as it was building collaborative leadership and moving the needle on poverty, we do not care whether it is on public education, whether it's on neighborhood development. Each city has its individual set of assets and circumstances and strong leaders, and they need to put those together in a form that works for them. And allowing them to choose their focus was really important because it meant that the projects are in line with the major priorities of community leaders, and so this work is reinforcing the work that they themselves are already doing in their cities. One of the criteria was that this could not be about creating a new program. It had to be about fixing systems. That's something that you just heard from Robin. This funding will not be sufficient to run repeated classes for 10 people over a 20-year span. This really has to be, because it's for 3 years only, this really has to be about what in your community could work better than it is working right now, and what can you together as a collaborative fix in your community that will have an ongoing impact on low-income people. We made our evaluation criteria public. We shared it with everyone. We talked about what collaborative leadership is and what specifically we were looking for in terms of public, private, and nonprofit participation, in terms of community engagement. And we met with folks many, many times during the process to explain and to have a dialogue about their projects and how they were ranking against those criteria. And then we only allowed each community to submit one application. And that was a really interesting part of the process for us. Many of our cities wanted us to choose. They said, we'll give you 6 ideas, you tell us which is the best idea, and that's how we'll figure out which group of people is going to apply to you. And with the encouragement of Living Cities, we came to the conclusion that this was the first exercise in our application process of collaborative leadership. Can you as a community figure out what your highest priority, most presenting opportunity is in the moment? And if you can't, that's an indicator of a problem. And if you can figure it out, it creates a new conversation and a new moment for the city. And we have had feedback from the winners and from the losers that was really a new conversation for folks across sectors in the city. And as a result, many of the cities that didn't win are continuing on with their initiatives. So I can say more about the winners if you'd like me to during the Q&A, and I have summaries up here if anyone would want them. What we came out with in terms of winners, we have 6 winners that have high-level public, private, and nonprofit leadership. I would say they fall into 3 categories. Workforce outcomes for parents, immigrants, and disadvantaged youth. Not surprisingly, lots of our smaller communities are very concerned not just about what jobs are created locally, but what jobs local people are able to secure. And they feel strongly that the workforce system isn't functioning for their low-income residents, that between a combination of community people, employers, and the workforce system, they can do better. Second, data-driven community change. So neighborhood developers working with cities for quite some time in many of these places really want to use data to look in a more granular way at what works and what doesn't on moving the needle for low-income people, and use that to make decisions about how the city spends its money so that it's spending its money in a place that really has impact as opposed to a place where we think it might have impact. And then lastly, increasing immigrant entrepreneurship. Immigrant entrepreneurs, great assets for these cities, and really something that the cities want to build up. I would say also one cross-cutting theme is in lots of these places we see major public investment in facilities and or economic development initiatives, and many of these cities are focused on how do we really leverage those investments to benefit our residents, not just our real estate tax base. So I will just say that now that we have winners, we are in a 3-year learning community. We have work plans, and the teams are hitting the ground in implementing their initiatives. So we have a lot to say about the early part of the process, but I'll be interested to hear from Monique about the late part of the process. However, we are creating a learning community to support them in their early planning, to create space and structure for having some of those difficult discussions, and then also to provide best practices and information that can really support people on the ground in their work. And, of course, this being the Fed, we are evaluating and figuring out a research agenda around what works in this intervention for our smaller cities. So with that, I will pass it to Monique.
Good morning, everyone. So I am the project director and have been the project director for the Strong Healthy Communities Initiative, which, as Robin stated earlier, is part of the Living Cities Integration Initiative. And I wanted to start off a little bit about just kind of laying the groundwork, for those of you who are not familiar with the city of Newark in New Jersey. Newark is about 180,000 people. It is a city with a very vibrant downtown, tremendous access to corridors. We've got our airport, we've got our seaport. It's a city that in recent years, particularly over the last 8 years of the Cory Booker administration, has experienced a tremendous amount of economic development and economic growth. But in Newark is also kind of the tale of two cities, right, that we see in most of our urban communities. We have, with Strong Healthy Communities, have been focusing particularly on concentrated poverty, concentrated low-income communities in our city, which has led our work to really focus in on a particular neighborhood in the South Ward of the city. This neighborhood, it's about 5 square miles, so it's a pretty sizable neighborhood to the size, based on comparative to the full city, which is about 24 square miles. And 4 in 10 children in the South Ward are in poverty. Additionally, it's a ward where there is very limited civic infrastructure. There are no community development corporations. There are no major service providers. It is a neighborhood where about 70% of the residents, both homeowners and renters, are experiencing housing cost burden. It is also the neighborhood that has the lowest performing schools, public schools, not just in the city, but also in the state. And so this neighborhood is essentially isolated from all of the economic opportunity, economic growth that is being experienced in other parts of the city. And so what we learned is that we really needed to focus our efforts in this community if Newark is going to really become a thriving city, competitive in the region. And it led us to this collective impact model, especially because of the fact that there were no community anchors in this community. We had no other choice but to kind of go collective impact. And I mean, considering, if for those of you who might have heard about Newark recently in the news, I mean, Newark is also an ed reform town, right? We've got there's tremendous growth in the charter school sector, which has, really turned around, school paradigms in our city. But it's also kind of caused a lot of tension, right? And so we know that education is kind of the silver bullet when it comes to, correcting poverty, addressing poverty. And we realize that there's a larger conversation that we need to have, which is we can talk about the achievement gap, right? For those kids who are in languishing schools, again, lowest performing schools. We can put a great teacher in front of every classroom, but the achievement gap is not going to fix everything, right? We know that in addition to the achievement gap, there's also the opportunity gap, right? Where we've got poor children who are under-resourced, who are just not showing up to school ready to learn. And so that's where we decided, of course, we have to pick like the hardest problem to solve, right? That's where we decided to really put all of our eggs, right? Around strengthening systems to improve academic and education outcomes in our city. And so that's where we started. We focused on the South Ward again because that's really where child poverty is really concentrated. That's really where the opportunity gap in our city is the most evident. Just some basic statistics. About 60% of student mobility, which is one of the lagging indicators for poor academic performance. About 60% of our students in our public schools leave school because of a housing-related issue, whether it's they've loss of housing or shifts of housing because of affordability issues. Additionally, asthma is actually one of the leading causes of our chronic absenteeism in our schools. Additionally, about 1 in 3 children come from homes that rely on food stamps to put food on the table. So that shows you that health, housing, food are very, very present in the education conversation. But because of the natural silos of sectors, we weren't having the same conversation. And so SHCI kind of set our sights to kind of grapple with bringing all of these pieces together in a very comprehensive way to kind of close the opportunity gap, improve child health and well-being as a lever to improving academic success, and then also figuring out ways to align and integrate systems and resources to better support schools and student needs. Because these schools that are the lowest performing are also the poorest, right? They don't have the social workers, they don't have the mental health professionals, they don't have all of the things that a high resource school would have to really address the significant need that exists. So that's the poison that we chose to pick. So that brings us to the table. To Robin's point, when we first started off our work in Newark 3 years ago, we were one of those sites that said, okay, let's have one table and bring everybody to it. And it's amazing how hard it is to get people to a table, particularly when we have so few high capacity individuals in a city of our size. So we realized that these are people who are actually sitting at about 7 different one tables. And it was really depleting our approach. And we had to kind of take a step back and say, you know what, this is more of a network approach. We have to bring together existing tables towards a common agenda. And so that allowed us to really identify who are the critical partnerships, what are the critical tables that are out there. We talked about, we engaged public schools, both on the charter side and on the traditional public school side, and very recently have also engaged early childhood, a number of different providers who are both subsidizing and operating early childhood centers. We've engaged our healthcare providers in the city of Newark. There is an organization called the Greater Newark Healthcare Coalition, which is actually a coalition of hospitals, doctors, specialists, other healthcare providers who have been convened for about 10 years. So we've brought them to the table to talk about child outcomes and education outcomes. We've connected to networks of housing developers and CDFIs. If you notice, what I said earlier is that there is no CDC in this neighborhood. So we had to bring in and attract a considerable amount of affordable housing developers and CDFIs to adopt and invest in this particular neighborhood. And then finally, city government, which is a critical piece of this puzzle, corporations and philanthropy. And so as a result, our one table turned into this. That's not one table. But if you notice, the way we now operate is that the leadership at each of these sector tables come together to have one common conversation around what does it take to improve education outcomes and child health outcomes in the city of Newark and in this South Ward community. We've got this, very recently we've started we've implemented this tagline that we start all of our meetings with that's called collective impact is potluck, not poker, which basically means that the folks that we engage their role is defined based on their contribution towards the goal. And it's not about the resources sitting on the table. And when you deal with typically very under-resourced communities, and you start off trying to grapple with a big problem, and we also made the mistake of starting off identifying the money on the table, everyone started playing poker, right? Everyone started trying to figure out, how do I basically run the table so that I can both build the capacity of my organization and, be a big contributor in the work. And we have since left that kind of paradigm and are now in very much of a potluck approach where everyone's contributing their piece and we're all being fed. And we are supporting the work of each other and enhancing the capacity of each other in very creative ways. And actually, we've got a few partners that are at this table that are finding that it's actually easier now for them to secure additional resources because of the fact that they have a collaborative partnership working in their favor. And so this kind of builds everyone's capacity all at the same time. I mean, one thing that I wanted to highlight, what with this being a Fed conference and all, is the role that capital plays in this work. One of the issues in this neighborhood from a capacity perspective, I mean, we're talking about poverty, essentially. This neighborhood has less than 100, again, it's 5 square miles, has less than 100 small businesses that have $1 million of annual revenue or more. There are no real significant businesses in this community, and it's leaving a lack of jobs, it's leaving a lack of resources. And so when we think about where are the capital investment opportunities to address issues of health, housing, food, and education, we have to really look at it from the perspective of where are our doctors and our healthcare providers? Are they in this community? What are the economic challenges that are preventing them from investing in this community? More times than not, it's Medicaid reimbursement rates and things of that nature make the bottom line for practitioners unmanageable. And so figuring out what are the creative capital solutions to create an environment where doctors can thrive. So we're working very closely with the Greater Newark Healthcare Coalition to really look at those business models. Additionally, when we're talking about food, particularly when you're talking about foods with high volumes of SNAP recipients, we have to talk about the grocery stores. We have no major supermarkets in this community. And so the bodegas, the corner stores, are the food providers, and truthfully, our school district are the food providers for low-income children. So that means that we have to really look at what's the bottom line for our grocery stores. I mean, these are more times than not independently owned, locally operated grocers who don't have the buying capacity to really put a quality, affordable product on their shelves. And so building a collective purchase power among, convening all of our grocers so that they together can put food on their shelves that can be affordable to purchase is a critical strategy that we're going to be focusing on for the next 2 years as well. And then finally, from the housing perspective, we put on the table through Living Cities about $8 million of capital to go towards affordable housing. And one of the things we realized was that the capital is now available, but we don't have any developers to now deploy the resources and get these properties online. And so we've been focused very intensely on how do we really build the capacity of both our local developers as well as our local contractors so that they can do local hiring and we can actually make sure that the dollars, once deployed, actually can churn in the neighborhood as much as we can. So it's a very complex strategy. It's a very complex table. I've lost much sleep, but the backbone role, that centerpiece, the SHCI backbone role is kind of a critical piece to keep all of these tables aligned, keep all of these tables focused on their shared agenda. Thank you.
Great. So hopefully you start getting a sense of how we move from concept to implementation. And the thing that I note is that this is not for the faint of heart. The folks here are taking on some fairly massive challenges in some extremely challenged cities. but also at the same time showing some very promising early results. So one thing that everyone sort of touched on, and as a starter for how to begin these initiatives, is the role of leadership. I think whenever we find ourselves in an initiative, the question of leadership and the importance of leadership comes up. But in these initiatives, they take on potentially different dimensions, whether it's leadership in convening or leadership in visioning or a wide range of things. So what I'd like for you all to do, or the panelists, would be to define the role of leadership. How is it structured? What are some of the challenges? And what are some of the important lessons with respect to leadership and the beginning process of getting these initiatives going?
So I can start.
Yes, please.
So the thing that's really clear to us after a few years on the road with this is that the leadership that's relevant in these kinds of initiatives is less positional than informal. And so what that means usually is that it doesn't matter who the person is who calls the conversation. What it matters is that that person has the respect of peers in the community, and so whether that sits at a community foundation or whether it sits as the school superintendent or somebody in the private sector, it doesn't matter who the first in is. What does matter is that the person be at a high enough level so that when they invite people to the table, those people are peers and they control the kinds of resources that Monique, I think, so beautifully talked about as being part of the potluck. Because if you get the folks who are convening the table at too low a level, then the table turns into kind of a reporting exercise rather than a change exercise. So it can be anybody functionally in a community, but it has to be somebody who can step up. I think that's the first thing. The second thing I would say, just in terms of the leadership that we saw, is that it operates at two different levels, and they're both important. The first level is the kind of co-chair of the table, the people who are the community foundation president or the person who leads the community from an economic standpoint. And that table and set of conversations has to be strongly navigated. But at the same time, there is a staff level where people who actually do the work when people go back to their own organizations have to be engaged and have to understand what's going on so that they can make things happen on the ground. And the coordination of both of those tables, the kind of elected leadership or positional leadership with the staff people who really do the work, is not as easy as it sounds. And then finally, I would say that leadership turned out to really be the willingness to call the difficult conversations and to lead those conversations in a way that preserved the relationships that people had, but also didn't ignore the issues. And so, for example, in Baltimore, it was really clear that when we said that we were tackling workforce or unemployment, what we were really tackling was a problem with the employment of African American men in the city, many of whom had all kinds of involvement with the criminal justice system that precluded them from being considered for the few jobs that were available. So when you name it, you can deal with it. When you're kind of dealing with some amorphous thing that people refuse to grapple with, makes it much harder to have those conversations. That's what the leadership role had to be at these tables, was really to call the questions.
And if I could just echo that last point, I mean, if we're really trying to make a change, it's going to address some systemic issues, and these thorny issues will surface. But that's part of the solution as well. And so the leadership becomes very important to managing the relationships and being able to surface these issues, as Robin describes, in a way that's productive and does it in a way that doesn't threaten people, but really starts getting to these foundational issues.
It usually does threaten people. Yeah.
Yes.
They just have to be willing to hang in.
And you need some very skilled facilitators to guide the conversation, for sure, because it could go off track very quickly.
Monique, do you want to take the leadership question first, or should I?
Go ahead.
Our initiative is the newest, so we have the least formulated results. I would say from our experience the leadership we see coming from a lot of different players in the community, and it varies community to community. In some cases, city executives are taking a leadership role, but in some places it's really the nonprofits. In some places it's nonprofits who are sort of poking their elected leadership. That works too. We are noticing that the high level involvement of the mayor does make a difference in the willingness of other people to sit at the table. We're also noticing that roles are really shifting as we're implementing, and the role of the backbone is becoming more and more important. It's a skilled role to keep everyone working together and moving forward, and in cities where we have capable backbone agencies, it makes a big difference. It also makes a difference for them to see themselves as the backbone and look at what those skills are and sort of work on that role. I also want to say, I want to talk a little bit about the role of community involvement. While it's rare, while we haven't seen, community involvement is an important part of the leadership formula in these places. We think that it brings a number of critical elements without which a collaborative can't move forward, which include a higher quality of information for the groups as they're planning their work, more accountability and more urgency. I think it's easy for people to walk away from collaboratives because they feel like they're not effective and they're not moving forward. It's easier to spin your wheels if you're not really answerable to a community that has a high level priority. And we see that the cities that have a capable agent or agents who are organizing residents to participate really have a level of energy that complemented with the leadership are an important part of what we think is going to be success. Oh, and I would say that in a number of those places, community development corporations are playing a critical role, both in bringing the resident leadership and also in sort of looking at the leadership landscape and acting as entrepreneurs to bring different people together and find new solutions.
So how has leadership played out in Newark, and what have been some of the challenges and some promising developments?
Yeah, I think, to what Tamar and Robin have stated, I can definitely support. In Newark, there's really 4 classes of leadership, right, that we have to deal with, or that we have to really be intentional about with our work. Of course, to Robin's point, executive leadership, right, because ultimately they're the ones with the most skin in the game, right, when it comes to making sure that we're changing systems and moving the needle in a way that's sustainable and that's really focused on long-term outcomes.
And examples of executive leadership?
Our city government is critical, both at the mayoral administration level as well as in the municipal council, we're finding very recently.
And they're involved at the tables?
They're both at the table.
So
now.
Representatives,
yes,
but not the mayor?
Yeah, and it's usually representatives who have the authority to make a decision at the table, who have been kind of given that authority.
Although in some of the cities, the mayor himself has sat, right? So in Minneapolis, for example, Mayor Ryback, when he was in office, sat at the table.
Yeah, I mean, one of the critical things also is, from a municipal government perspective or a public sector perspective, that second level of leadership is kind of the managerial leadership, which is critical because in Newark we've had 4 mayors in the last 3 years. So having the mayor at the table is great. For a time. But what we know is that civil servants are always there, sure, right? And so that managerial leadership, those are the folks, and those are actually kind of that's a hard kind of worm to turn, right? Because generally those are folks who have 20 years in, 30 years in, are used to doing work the wrong way, right? And what we've found that having those managerial advocates, those folks who bought in, makes life tremendously easy. And so having that managerial leadership, both at the institutional level and also with the organizations, is critical. The third is definitely civic, to Tamar's part, to her point. We have to have the community engaged. You have to have the community aware to hold everyone accountable. And I think the last level of leadership that usually is the level that no one really talks about, interestingly enough, is the invisible leadership, which is basically you have to have those people, particularly when you're doing collective impact, who do work with no credit. Those backbone is having invisible backbone actually works better than having a very prominent backbone, because when you're convening executives, okay, I'll say egos. I was trying to be gentle. When you have that much ego at the table, the last thing that's needed is at the center another ego, right? And so having that invisible leadership of backbone that can kind of just in a very maternal, motherly kind of way, persuade folks and keep folks focused on the big picture is a critical piece of the puzzle as well.
And I've personally witnessed Monique being the invisible leader with her backbone. She does a great job. Actually a related point around leadership. So one aspect of this is sort of setting the grand vision. And actually I think setting the grand vision can be a little bit easy, but then how do you actually start figuring out how to define that grand vision and defining the different component parts that may start to affect that grand vision and that grand metric? So in your initiatives, how did you go from concept and vision to actual implementation and just as importantly, defining the problem? What is the problem that you're trying to solve? And how did that play out in your various initiatives? And you can talk about the role of data, how you manage, recognizing that this is a dynamic environment and it's a learning environment. So all those different aspects.
Data is critical. And in Newark, unfortunately, when we started our work, we thought we had a lot of data. But you'd be surprised how hard it is to find good data. And so when we started our work, it was really hard for us to really define the problem because there just wasn't enough quality information out there to really substantiate. So a lot of it was concept, a lot of it was theory. But where we are now is, we've worked very closely with the community to help to have the community define the problem for us through qualitative efforts and engagement efforts. I think what's also with our process going from kind of the grand vision or even defining the grand vision to actually operationalizing, where the rubber really met the road for us, particularly when it came to institutional leadership, was defining what the real strategies and the metrics were to measure outcomes.
So can you talk about that a little bit in more detail? So what is the problem that you guys defined, or what was the original problem, and how did that change, and how did data play a role in that?
So kind of our big statement with Newark Strong Healthy Communities is that all children in the city of Newark will be healthy and ready to learn. And so we were fortunate to have a number of national models to draw from. The one that comes to mind, the easiest, is the Strive Together network out of Cincinnati, Northern Kentucky. And they have really helped us take their framework and implement it locally to really figure out what's the problem we're trying to solve, how are we measuring that problem, how are we tracking that problem over time. And so we worked very closely with Jeff Edmondson from Strive, who facilitated a number of different network and partnership meetings, which were very painful. But once we got to that point of saying we need to move the needle on not just education, but on housing outcomes, on nutrition outcomes, on health outcomes, it started getting into a very uncomfortable space. One is, again, we started off really going hard at education, and then once our education partners started realizing there were other people now in their space, it became very uncomfortable. We had issues with, what does this, are you trying to replace our school nurses? Are you trying to, it became very politicized very quickly, small p politicized. And so it took a lot of time and not to mention, we also had a number of people at the table who very soon found out that what they defined as the solution to the problem was not considered a best practice solution. And that's a very sobering moment for partners, particularly nonprofit partners who are fundraising. Once you use the data to really define the problem, both qualitatively and quantitatively, and then identify the best practices across the country, because none of this is new, right? Identify the best practices across the country to really grapple with those solutions. You have to take it at the pace that people are comfortable with doing, but it's a critical process to do. Do not underestimate, for those of you who are just starting collective impact work, do not underestimate the amount of time and labor intensity that it takes to bring people along to working together on a common vision with a common agenda. It is very, very difficult work to do.
So I would say a few things, and Monique has lived this, probably more than anybody in the country, and so the fact that she survived to tell the tale, is really...
still here.
She's still here. So I think there are a couple of themes that I would pull out of what she said that I think happened everywhere that we worked, and that are important to pay attention to. The first is that there's been a real emphasis in the field, a growing emphasis on measurement and on metrics and doing what works, and that's really great. Except that it drives us sometimes to think in a kind of linear way about inputs and outputs and outcomes and impacts, which if the world were a scientific lab with lab rats, might work. But there's a lot of looping around in the real world that has to do, as John was saying initially, with complexity theory and what's connected to what, and everything is interdependent. And so if we go into this work with a linear thing in our head about, first we're going to do this and then we're going to do that, so just forget about it. This work is the definition of emergent and adaptive, and you can't know where you're going to end up if you really follow the truth of what's emerging from the work, and that's okay. And, a lot of the job that Monique and the other integration initiative directors have done is to sort of calm people down that this really is all right. We're going to iterate, we're going to loop, we're going to learn, we're going to figure it out, we're going to follow things where they lead. And so we can't expect of ourselves, to know at the beginning what we're going to know at the end. That's the first thing. The second thing is that it's really not easy but trivial to say, we want all our people to have, access to good jobs and healthy food, and, it's motherhood and apple pie, and except apple pie, I guess, is not healthy food, but, you get the idea. And then when it comes down to translating that vision into something that you can make choices about and take action about, which I think was very much illustrated by Monique's story, then you realize that, well, we're not looking at all health indicators in Newark. We're looking at kids. And we're not looking at all kids. We're looking at the kids who have a problem. And the kids who have a problem are not evenly sprinkled around. They're in a place. So now we're looking at kids in a place. And the same thing happened in Baltimore, and the same thing happened elsewhere. So being able to kind of narrow to where you really have a problem that you can do something about is an important part of the process. And the symptom that you're not getting there is if you have 150 indicators, right? So at one point during the integration initiative, we found religion about indicators, and we started bothering everybody that you have to have an indicator. So one of our cities, which tend to overperform, on everything, came up with 150 indicators. 150 is equal to 0, right? I was not a math specialist, but this I learned. If you have 5, then you can guide your work, right? If you have 7, you're pushing it a little bit. If you have 1,500 indicators, forget about it. It's the same as having nothing. So I think that was part of the journey in terms of what does it take to get from a very high-level vision to something you can do something about.
And then just a follow-up question. So how do you talked about systems change. I mean, collective impact is about systems change. But when you get drilled down to an actual micro level, how do you differentiate those activities at the micro level that are actionable and associate that with sort of the systems and the theory of change?
You want to do that one? I could start it.
It's actually not it's a little bit of a trick question.
Yeah, so I don't know that anybody has a great answer. The way I explain it to myself is there is a methodology that a lot of tech companies use that they forced us to read the book, so I now, force you to read the book, that's called build, measure, learn, right? And so if you are building the minimum thing in a project that you need in order to test some kind of hypothesis about changing the system, then it's legit, right? Because how else are you going to change a system and know in this kind of complex, emergent world that you've actually accomplished something? It's not so easy. But sometimes when you do a demonstration of some kind, you're poking at the beast and you're waiting to see how the beast reacts. And one of the things that apparently is true in complexity theory, about which I am not an expert, is that things can have disproportionate results. And so you're looking for those leverage points. And the way you test that is by changing how you respond to different challenges. So that's the best answer I have at the moment, which is quite unsatisfying to me, but there we are.
So Tamar, what's the problem with the working? How do you guys define the problem?
What's the problem? Well, what's our problem? What's their problem? We are in this right now. The cities have a grand vision, they're operationalizing, and we're really pushing them on the question of data. I think, a lot of the collective impact work actually is work that good and talented leaders have been doing big pieces of in their communities for a long time. But actually the data question, a lot of people haven't been engaging as much, and we think it's helpful. Here's an example of why. One of our cities is very capable. They have a lot of capable people running capable programs, and so they said, we're trying to deal with unemployment among immigrants in an immigrant neighborhood. So let's have ESL and job training programs. Terrific. Combined ESL and job training. Only when our capable staff looked at the data, what they saw is that the vast majority of their unemployed people are single mothers with some college education, which means, incidentally, that their unemployment problem isn't about people who don't speak English. It's different, and really pushing them to look at that data and not just assume that because you do something good, it means that you're solving your most serious problem. You might be, that work is never bad, but it might be spent better if it were targeted more effectively. And then I guess I would say there's also the data as measurement question that our cities are really trying to figure out right now. And I would love to learn from Monique, because finding the right type of data to measure your efforts is hard. People automatically go to program data. So they say to us when we say, what is your result? 12 people will participate in this program. Great. Do they get jobs? We don't know. What do those jobs pay? We don't know.
How many of the people who have the problem does the 12 represent?
Right.
Less than 1%. Oops.
Right.
Yeah.
But on the other hand, the data, the sort of bigger level neighborhood or city level data, you can really only get once a year at best. Mm-hmm. And trying to find that right indicator that you can measure regularly and that's really telling is an art, and our cities are trying to figure it out. We're trying to figure it out too. We're having a discussion about that in a couple weeks. So.
Yeah. The data piece is so critical. So one of the things that we'll be doing over the next 2 years, and again, to your earlier part about the critical role of civic engagement, we'll be doing basically periodic quarterly data walks with residents. We've worked very closely with our higher education institutions to comb every data source out there on every neighborhood level indicator we can find relative to education, housing, health, food, just to start painting some pictures. There are models across the country that we've drawn from, such as like Detroit, for instance, has a great one, Data-Driven Detroit, for those of you who might know of their work. Of course, Urban Institute in D.C., there's a number of them. In fact, there's an organization called the National Neighborhood Indicators Partnership that you all should definitely Google, because there's partner agencies across the country doing really innovative work around data as a tool to democracy, right? And so I think we really have to think about this in terms of defining the problem and getting to the solution. Think about it the way you'd think about a marathon, right? I mean, if you can define it, you might know where the end is, right? And you've used the data to find that end. But no one's going to start a marathon at the starting blocks, waiting for the gun, and then put on a blindfold and then start running, right? You're not going to get there. And so consider your community that you're trying to affect as the removal of that blindfold. Have points in your work where the community can participate with you on mile markers, telling you, yeah, we're getting there, things are getting better, both qualitatively and quantitatively, because a lot of this information, to your point, is annualized information, and there are flashpoints that happen monthly in some of these neighborhoods. And so having those opportunities to both connect data to residents, it actually empowers the residents that you're trying to affect. It empowers the stakeholders and the community partners that you're trying to engage. And it also keeps you on course.
So I will make a shameless plug at this point for our a recent publication that we had, the San Francisco Fed, on collective action, where there are different models. So FSG has written an article, the Living Cities Integration Initiative is profiled, the HUD Sustainable Communities Program. But with respect to this data question, there is a fabulous, fabulous article in here, the Magnolia Initiative. And just as an example, I mean, this data issue cannot be understated, because it's the articulation of the vision and sort of the action arm of these initiatives. And so the Magnolia Initiative, provides some really helpful suggestions. I mean, really how to. So it's not helpful to say we're going to improve third grade reading scores, because it doesn't empower you to know what to do about third grade reading scores. So instead, they give a typology of action steps. So focus on outcomes, focus on behaviors. Parents can make a big difference if you read and they measure. The Magnolia Initiative measures how much time a parent spends reading to their child. And as they do so, they see that their child improves in school. So it's what Monique was saying, is that connection between the kind of change at the very micro level, but actually defining within a broad structure of data from top to action. So it's a great article.
I do want to say it's a little incumbent, I think, on funders and intermediaries to be clear about what they mean when they talk about data, because when we talk to our cities, a lot of them about data, a lot of them assume that we mean prove to us that you're doing your job. Tell us that 12 people came to the program and you held it for 12 weeks in a row, and that's not what we mean, and it's on us to say that. We want to know how you're learning about your work, and how you're figuring out what the problem is, and how you know if you've made adequate progress. And if you haven't made adequate progress, that's okay, as long as you're figuring out what you need to change. So it's really not about program accountability to us, it's about learning.
So this will be the last question before we go into Q&A. And our Q&A, again, is going to be action-oriented. So think about your initiatives, think about things that resonate with you, and think about your questions in terms of how all this stuff applies in the communities that you serve. So last question is pace and milestones. So, once a table is formed, a collaborative form, a practical challenge is maintaining the pace for participants to remain engaged while setting expectations that in ways that they're not familiar. So how do you keep the table together? How do you keep the momentum going? Because, sometimes some parties are invited to the table and they should not have been invited, or they're not ready yet to be involved. So how do you keep the pace? You get through thorny times. How do you keep the momentum going? What are some important guiding principles?
What we found in Newark is don't expect a consistent pace, for one, right? I mean, it's okay if you have fits and starts. It is the natural, it's just the nature of this kind of work, because you're working on a very complex problem and with a very complex set of partnerships in a very complex environment, right? And so to assume that you will have pace is probably an assumption that will frustrate you very quickly. I think also it's critical to keep in mind that this has, for many of our communities, the problems that we have defined have been problems for decades. And so it is okay, and it takes a considerable amount of time. I know in Newark it took a considerable amount of time to begin to onboard people to the concept of long-term systems change, right? That we're setting a 10-year, 15-year course. And considering the fact that we've got public sector officials who operate on 2 to 4 year cycles, we've got philanthropy that generally does 2 to 3 year grant making at max. We've got nonprofits who do annual budgets. Folks are not naturally inclined to think long-term strategy. And so keep that in mind as you move. It took, and Robin can probably attest to this, in Newark, it took us a tremendous amount of time to get from program speak to system speak. Most people who are doing this work speak by program. We're just taught to speak by program. And that's a totally different language than when you start talking about systems, particularly when you have organizations that don't naturally even see their own system. And so, the pace of this work has to be slow and steady. It has to be to the level that people can endure, because if you move too fast, people get exhausted and they disengage. And so finding those opportunities to, check in and see how folks are feeling, if there are strains on their systems as they're making these shifts, finding ways to set those benchmarks and determine, like we know, for instance, our health department is a critical partner in our work. And we realized about 6 months ago that we put a tremendous amount of strain on them when it came to working collaboratively with our public schools, a tremendous amount of strain. And so it was important for us, and again, this is where kind of the backbone becomes critical, to have those type of and Robin, you're probably going to think this is kind of ironic that I'm saying this, but one of probably the most helpful tools to our work was actually evaluation, process evaluation, finding ways to periodically evaluate how people are honestly feeling and behaving with their work, so you can see where there might be troubles emerging. And find ways to tackle those adaptive challenges head on. So go as fast as people are able to go.
All right, Robin and Tamar, really
Yeah.
quickly so we can get to questions.
So what I would say is, just echoing Monique's piece about adaptive leadership, there are a series of books that honestly, changed my life, not really to understate it, about adaptive leadership and what that requires, that are by professors at the Kennedy School. Linsky is one of them. Leadership Without Easy Answers is one of them. Look online under adaptive leadership and take a look at some of those books. They are amazing. But this idea that you disrupt the norm at a pace that people can tolerate is really key. And understanding what that pace is the work of leaders like Monique, who have the scars on their backs to prove it. And I think the other thing that people have to get used to is not everybody who starts at the table finishes at the table, and that's okay.
The only thing I would add is wins along the way are so important. We were lucky to have a competition so that people could have an early win, and that could reinforce the work they've been doing. But so even though a program for 12 people might not solve the big problem, if that's going to make the group feel really good, then let's say that's part of the strategy to get there, and let's take a moment to celebrate it and, ramp it up from there.
All right, so we've got about 12, 13 minutes. So we'll take a couple questions at a time. And again, try to really be succinct and around how this how this impacts the work that you're doing. Over there, if you could introduce yourself. Go ahead and speak up.
Okay, or should I?
No, just go ahead.
Okay. Should we get the name and organization?
Yeah.
So it's recorded.
Oh, it's being recorded.
Okay, so I will use the mic. Hi there. My name is Matt Weinstein, and I'm a city planning master's student at MIT's Department of Urban Studies and Planning, a place that I know you know well, Tamar. And actually, my question is mostly for you. So I'm doing my master's research on the gateway cities of Massachusetts and kind of the series of initiatives around the gateway cities and what has basically emerged as a small cities movement in Massachusetts. And just really a tiny bit of context for people who aren't familiar, which is probably most of you. Massachusetts has been unusually proactive over the last 6-7 years in terms of bringing this class of cities together as a group and developing tools and policies that target them. And so I'm curious, just from your position at the Fed and working cities, I think your cities, with the exception of Somerville, totally overlap gateway cities. What you've seen coming out of this increased discussion around small cities, and whether you have a sense, and I gather this will be probably fairly anecdotal, but that the gateway cities work, that this phenomenon of small cities working together on state policy, talking to each other, that it's improved civic capacity back in the individual cities.
Okay, improving civic capacity in gateway cities. Next question.
Hi, Erin O'Keefe from Loyola University in Baltimore, and I serve as the backbone for a group that's called the York Corridor Collective, which has interesting aspects in and of itself. And so I have two questions. One's around branding, and when you work for an anchor institution and you are the invisible backbone, it gets a little bit complicated sometimes, so general thoughts on that. And also branding for the multiple members, techniques or resources to give them some credit, but then also keep the collective moving forward. And then the second question is, one, can I steal your potluck reference, because I love that, or is it branded? And
Gets a royalty every time you use it.
And what's our support network moving forward in this work? Because it is very, very draining. And Monique, I'm honored to be here and to listen to all of what I've learned today. And I think this is the way we need to proceed. So how can we keep sharing resources, whether it's how to collect data from all these multiple partners that are coming in and then be able to communicate it out in a way that's efficient and effective? Thank you.
All right, so increasing civic capacity, branding, and a support network.
I'll take the civic capacity question. And Matt, it sounds like you and I should talk more. The smaller cities in Massachusetts have formed a sort of political alliance, and state policy has grouped them together as places with similar needs, which has been really helpful with policy. But the state's main tool for helping the cities is really investment in bricks and mortar and investments in the public education systems. And I think that what we're saying is, and what they are seeing, and the reason they're a partner with us, is that those investments aren't going to work and they're not going to have a transformative impact on a city unless you have the civic infrastructure to really make them successful for a local community. And the cities that are sort of pulling to the head of that pack are the cities that have those capacities. And interestingly, it's the cities that feel like, in some cases, the cities that feel like they're doing better and have sort of the old traditional leadership that are really falling to the bottom. And they feel like, we've got this covered, we don't need anything new, and it's a mistake.
All right, branding and support network. Robin?
So, branding, that's a really good question, because for what I'd say the first year and a half in Newark, all we were living cities. Because Living Cities was our major funder, it was, the Living Cities Project in Newark. No, we're not Living Cities. We're funded by Living Cities. And we had a big tension around branding for a good amount of time. how we really grappled with that, because we're dealing with the challenging dynamic of not wanting to be a new thing, right? Not wanting to kind of become an organization which actually ends up having a repelling factor to other organizations. So we actually started our work branding ourselves as a campaign. And it was actually pretty disarming for a lot of organizations. So for those of you who might be political junkies, think about how campaigns structure themselves. Think about how, and I don't mean like, candidate campaigns. I mean more issue campaigns. How they structure their communications, how they structure their work, how they structure their messaging, and steal most of that. Because we find that setting ourselves up as a campaign has actually allowed us to become more of a brand in our city and actually institutionalize ourselves a little bit more successfully in our city than if we were to start as a nonprofit organization or kind of a standalone organization. I want to speak specifically to your question about being a backbone in a major anchor institution. That's really, really complicated. I mean, we're dealing with that issue both from a kind of a program backbone support perspective as well as from a data infrastructure perspective, because major institutions, it's very, very difficult to kind of separate yourself but still leverage the power of being in that institution. So I wish I had an answer for you, but I don't know that yet. But I will say the support network question holds a critical solution to that problem, which is, I mean, we're fortunate to be part of the Living Cities National Integration Initiative. So we've got cities across the country that I honestly call at unreasonable hours of the day to just either vent or figure something out or get a connection on an issue that I'm grappling with. I'd say also the Strive network, Strive Together, is also a critical network of national collective impact partnerships. So I definitely would love to exchange information after the session, and I can tell you a little bit more about that.
Tamar?
I also find identifying as a backbone is helpful in attracting support. I mean, I think, like I said, there are some very talented leaders in these communities that have been building consensus and doing related models for a long time. I think the field is increasingly coming to realize the importance of that role, and being able to identify yourself as a backbone and sort of move your structure so that it's more in line with some of these items makes funders more sympathetic, and they understand your impact better. And we've seen that help a lot of our groups attract additional funds.
Mm-hmm. And then I would actually add another resource is the FSG. They have a collective impact forum, so it's a collection of a lot of different resources and actually a forum for all the different practitioners from multiple sectors working on this. 2 more questions, and then I think we'll be out of time.
I'm Joyce Marin. I'm with Renew Lehigh Valley, which is a nonprofit. We operate near Allentown, an hour north of here. And I'm involved in a consortium for a HUD Sustainable Planning Grant, which is wrapping up at the end of this year. And I started in September, and it's like I came to a poker game thinking it was a potluck. And I do the public outreach, which is, I'm doing it effectively, and it's annoying some people. So it really helped me for you to talk about the issue with the schools, that how they were threatened, about scars, pain. So I'd like you to talk a little bit more about that and effective solutions, the support that. The earlier question about support, that's obviously a help because you're going to be walking through the fire anyway, but just how do you have the conversations to put people at ease that it's really all going to be okay even though things are changing?
Okay.
Jean Horstman, Enterprise. Since we're playing with metaphors, Russ Akoff, who used to be at Wharton before he passed away, described any problem that's got high touch and high levels of complexity, particularly around technology, as a wicked mess. And I've often wondered if we should change collective impact to wicked messes. Because they happen everywhere and we'd learn a lot we could use in other sectors. My question is the question of trust building. And processes and systems and good that all is usually touted as what builds trust, but trust is really relational. So I'm intrigued about the ways in which you've built trustful relationships between the participants and how that gets sustained.
So it's actually a similar question. So going into a poker environment, how do you really establish moving more toward potluck, especially with the element of trust? And really brief answers.
I'll start. We gave people too much money. And part of the reason, I mean, it seems ridiculous to say that, but part of the reason I think that Monique ended up living through the dynamic that she talked about is when you put $3 million on the table in an under-resourced place, you distort what's going on and you make it about money when it's supposed to be about relationships. And so I think Living Cities learned its lesson, and in the current round of the integration initiative, started with planning grants of $100,000 per city to see what people could do.
Others? Tamar?
I feel like you're going to have a better answer. I think you should go for it.
So in terms of trust building, you're right. I mean, it is relationship oriented. It is an art, definitely not a science, and it requires a tremendous amount of kind of one-on-one cultivation. I think one of the things that we all need to be very honest with, and in fact, I got this from Jeff Edmonds from Strive, that when you get to the table, it is okay for people to state their agenda. In fact, it is a huge misstep if you convene a table and agendas are not stated, because everyone comes to the table with a very specific agenda in mind. And so naming what your deal breakers are, putting all of that out there very early on in your engagement. So I know you're coming in midstream. So knowing what the deal breakers are and knowing what the triggers and motivations are for those who are at the table, and finding ways that your work can speak to those needs are very critical strategies to building trust with individual stakeholders, and from that, disarming the trust of the group ends up developing.
Thank you. Tamar?
I'm going to put in a little plug for smaller cities. We think that it's a bit easier to do this work in smaller cities where people know each other even if they haven't worked together, and our evaluators are feeling the same way right now. We'll see where it goes. The common agenda needs to be the guiding light and the reason that you can explain bringing new people to the table and what their roles are going to be. And the work is really hard, but I worry that we actually want to attract people to it. So I'm going to say really high potential and very rewarding, even if it is sometimes messy.
And then this trust issue also comes out on the data side. So being able to articulate the data on the collective goal tends to shift the focus from myself, my program, and the organization that I represent to what can I add to the potluck. So with that, I know we can carry this conversation on much, much longer, and I hope we can in other ways, but please join me in thanking our panel.